Hey, gather close to the radio. Dr. Klein is in. The doctor is in the house or in the studio, as it were. And this is the Rob Newton Resource Hour, and we've got the doctor right here with us. And today we're going to talk about a topic that is very, very close to the doctor's heart. And what was that topic again?
It's medically related death, okay?
Whoa,
No,
we don't want that.
No, of course you don't want it. It's one of those things that most doctors try real hard to avoid. But unfortunately, okay, it's one of the leading causes of mortality in the United States. Okay, it's called iatrogenic, or by the hand of, or by cause of physician-related interaction. So what can happen to those poor 150 to 250,000 people that are estimated to die every year from medical mistakes? Many of these things are at the hand of the physician. Now, that could be direct, okay, surgical. It could be direct malpractice, although that's very, very rare, actually. Medical malpractice is rare, but drug-drug interaction is not. Ignorance is prevalent, and ignorance kills. So what am I talking about? What I'm talking about is this. Gee, Mrs. Jones, it's so good to see you. What's bothering you? Well, gee, I have a urinary tract infection. How do you know you have a urinary tract infection? Because I've had 15 of these in the past, and this is number 16. Okay, good. The doc is now done. You got your 60 seconds. You're about ready to get the prescription. The doctor, on the other hand, does not necessarily know everything that person should know to make an intelligent decision. Why? Because they are imperfect, and you didn't bring your medication bottles in, sit them down because you think that doc knows everything about you. Well, ignorance is bliss, okay? The docs generally don't have a complete picture. It's called an incomplete database. And so now comes a decision. Gee, Mrs. Jones, do you have any medication allergies? Okay, well, as you get older, it gets a little bit harder to remember things. I don't know if you've ever heard that, but gee, I forgot that I might have had that sulfa allergy 20 years ago. Do you think it went away? And odds are not so much. Well, you realize that there are anti-inflammatories that are sulfa-based, but there are lots and lots of antibiotics that are. So guess what? Out comes the script for Septra, Bactrim, whatever you want to call it. It's trimethoprim sulfamethoxazole, and a mistake can be made. Well, that's an easy one because the pharmacy might have a record that you have a sulfa allergy, okay? Unless you go jumping from pharmacy to pharmacy, which happens because this one might be the wrong time to get the sale at. It's just not going to work for you. But what's more is this. The doctor might not know about the blood pressure medicines you're taking because you're getting that from your cardiologist. So if you're getting an ARB or an ACE inhibitor, okay, if you can end up with that 1 in 10,000 case where it causes sudden death with a sulfa product. Okay, so the doctor needs to know what is going on, and you are not necessarily in a 100% position to do it because you're going to think that because you asked Dr. Jones to send the records to Dr. Smith that it actually happened, and odds are it did not. So what I'm advising patients to do, and this is kind of an interesting change in paradigm. You are going to be your own boss. You are going to be the master of your own universe, or at least you're going to have one hand on the control. So what we're doing is setting up a program, okay, which is funded and paid for by Medicare. Go figure this one out. If you have no secondary, the out-of-pocket's expected to be about $9 a month. If you have secondary, the out-of-pocket cost is $0, where you can go ahead and have your medical records available to you, basically not on internet. Okay, it's not like you're going and seeing it on the cloud, but this is actually sitting on a secure medical server where only you have access to your data, so you can print it out, export it, email it, or fax it. Fax being the safest means to send these things out by some strange twist of fate. So what are we doing? At stages of life, we're inviting our patients, we're inviting other doctors' patients, we're inviting anybody who really cares to do this to join us. We will maintain your medical records and basically bill Medicare for the service. What's the ultimate downside? $9 a month if nobody else is out there. Guess what? You will have access to everything that you need to have access to. And how does this work? You fax us your records or hand carry them in or mail them in. Mail being the best way to do it. We scan them in, we separate them out, make them visible to you on the patient portal, and you can now make sure that any doctor you ever see can receive any bit of information that you choose to share with them. This is the ultimate empowerment.
Wow.
So when you go to your dentist and your dentist asks, well, gee, what medications am I taking? You go to your phone app and you can print your medications in the instructions that they need to be done. What about your EKG? What are you going to do? Call the cardiologist and hope that they'll fax it to your family doc? Not necessary. You have it on your portal. What about your lab work? What about your MRIs? All of these things need to be immediately available to you in case you are in trouble. So what happens if you become septic? Never happens, right? Okay, well, gee, Aunt Sally fell one time. Okay, well, I guess she might have been dizzy. Heck no. Most of these falls in the elderly, in fact, most falls, period, other than athletic falls, are due to infection. Okay, the data is very, very new, very, very compelling. People get dizzy for a reason. They percolate along, they do just fine, and all of a sudden they fall down and break a hip, only to find out that what caused it was most typically a urinary tract infection. So the very last thing you need to do is to be brought into the hospital in a meat wagon and somebody finding out the hard way that you have an allergy to penicillin. That can kill. You know, I spent the weekend with a fellow who basically died. He says he's died twice. He looks too good to have died twice because of an antibiotic error in the hospital. So these things happen. Okay, other than the fact that he had to have a trach, he looks pretty good. Okay, and this is why we're doing what we're doing. And so with this CCM program, we are now opening to everybody. We have an Android app. We have an Apple app that was recently approved. And what we're going to do is avail other people to join us in the Stages of Life family.
I mean, for that little cost, it's even a great help when it comes to updating Medicare Part D.
Oh, you would think?
You've got to have an accurate list of your prescriptions, which most people don't have.
Yeah, and if it's wrong, you fix it. You go on, you use your computer, go onto your record, and correct it. You can do this as many times as you want to, as frequently as you have to. Only you have control over this data. It's the way it works. It is a marvelous system. It costs 2 years of my life, a bunch of money, and guess what? It's going to cost you almost nothing to participate.
And you're going to have it right on your smartphone where you just tap some little icon.
Well, these days you can't find a stupid phone, okay? So it's going to be available on your phone. It's not going to be an internet link.
Right.
Okay, this is a real bona fide app with a little butterfly on there. It's actually kind of cute. It's a manly butterfly, just so you know. But it's a butterfly nevertheless. You click that little sucker, you'll be able to go to your portal where you'll be able to see what you need to see. You can see our blogs. You will be able to see our radio, or listen to our radio shows in this case, and our 10-minute segments. So it's going to be there for you, and guess what? It's probably not going to cost you anything.
Let's talk about the portal.
Okay, the portal is kind of an interesting thing. Now, under the High-Tech Act of 2009, all doctors are supposed to be able to provide you with a data entry into your records called a portal. The sad fact is that fewer than 20% can. Okay, so it's less likely than not that your family doctor or anybody else is going to actually be able to fulfill the requirements under the High-Tech Act of 2009. In order to do what we're doing here, you have to be portal activated. You have to be able to do this. Most doctors aren't. Most docs, fewer than 20%, are meaningful use to certified. This is awful. And so what's going on right now is that the docs are going nuts. They're quitting because they're about ready to get their shorts fined off for not being able to do this. And at Stages of Life, we did something that a lot of people don't do, and that's to take the law real seriously and follow it. So we have spent time, money, a lot of aggravation, gray hairs, call it what you want, to provide people with the portal, which is a doorway, hence the term portal, a doorway into your medical records, which even when you get the password and username correct, sometimes it's not good enough, because if the system doesn't recognize your computer, it will not give you access. We are very secure. We are very tight about our security and take security very seriously.
And it's very user friendly. I love it. I can send notes to you. I can send notes to your people. I can talk about, what medicine was I on 5 months ago?
Yeah, and then we're able to answer it and send it back.
It's so easy.
Yeah, and if you were so inclined, you could go in there and make requests for appointments. Now you can't make your own appointments, not like Open Table, app, because we're not going to stick you on top of somebody else as you come through the door. But if you needed to have something, we personally will answer your calls. Or text messages within 4 to 6 hours. So most physicians' offices are not able to do this. And with regards to disease management, chronic care management, very, very few are ever going to be able to do this.
Let's start it with a visit.
That's right. Give us a call at 407-679-3337. Visit us on the web at stagesoflife.net. Our office hours are Monday through Thursday, 8 to 5. The health store is open during the same office hours. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And we are on Facebook at Stages of Life Medical Institute.